It's common for families to come to a psychiatrist looking for a diagnosis, looking for reassurance about what's going on. This is trickier in people with anxiety and OCD. We have to be careful about providing reassurance. We certainly want to help a patient and a family understand the diagnosis, what the resources are, prognosis. But we also have to know that reassurance is often a core symptom of what's happening with OCD. So if you notice that a patient is seeking reassurance repeatedly, asking the same question over and over, perhaps in slightly different forms, but essentially the same question, then I think it's up to us to say, this is part of your OCD, and that we can't continue to answer that question because they know the answer. It's not gonna feel good enough to them for us just to give the answer. It's just, I always call it, we're feeding the beast of anxiety when we provide that reassurance over and over. So often how I'll handle it is, because we want to be compassionate as well, is say, hey, I've noticed that there's this theme of you asking a particular question over. So it might be, often with the psychiatrist, it's around medication, because that's a role we play for them a lot. And so I'll say, what have you heard me say about this whenever you've asked this question before? And what do you think the function of this question is of you continuing to ask me? Do you think it could be part of your OCD? And I often try to coordinate with the therapist as well, to see what kind of reassurance that they're seeing in their offices, in addition to what I'm seeing. But we do have to start to help them recognize those patterns, that's part of their core symptoms that they're dealing with.